All right, so we're not actually going to talk about arthroscopy. We're going to talk about total ankle replacement. And I think the last two speakers reverberated something that's extremely important, which is your practice now should not reflect what your practice represented 5, 10, 15 years ago. You constantly have to evolve. So whether it be with a CT scanner or whether it be with a new technique or technology like a while osteotomy and a plantar plate repair or CPR, I think it's important that you are adept to these procedures so that we can continue to give our patients the best medical option going forward. So why a total ankle arthroplasty or replacement? Severe painful post-traumatic osteoarthritis is the #1 reason. In fact, there's a landmark study in JBJS 2008 identifying that end-stage ankle arthritis is as severe, if not worse, than end-stage hip disease. So you know how many hip replacements are done in the United States per year versus how many ankle replacements are done in the United States per year. And obviously the numbers are staggering in favor of the hip replacements. But when patients are pulled, their ankle arthritis is just as bad, if not more severe, than their hip disease. So what do we do about it? Causes of arthritis, secondary osteoarthritis. So when ICD-10 came out, the arthritis is separated into primary and secondary, and I always wondered what the heck is secondary arthritis. Secondary arthritis is trauma, 80% of the time, fractures, repetitive injuries, ligamentous injuries, people with Ehlers-Danlos, people with lateral ankle instability that their ankle joint is functioning off kilter, microtrauma in athletes, osteochondral defects that propagate, things like that. Whereas primary osteoarthritis makes up 10% of the arthritis in the ankle, misalignment, wear and tear, aging, family history. So lo and behold, when you choose your ankle arthritis codes, there's post-traumatic osteoarthritis, secondary osteoarthritis, and primary osteoarthritis. The post-traumatic and secondary fall in the same ICD-10 code verbiage.